Many people experience gastric issues. These problems, like heartburn or indigestion, are common. They happen when stomach acid bothers the lining of our digestive system. This can cause discomfort and pain. While occasional indigestion is normal, frequent issues can disrupt your life. The good news is that simple changes can make a big difference. By understanding the causes and making adjustments, you can find relief and improve your digestive health. Let's explore some practical tips to combat gastric problems and keep your stomach happy. Gastric problems often arise from an imbalance in stomach acid, which is essential for digestion. Our stomach produces acid to break down food, aiding in the absorption of nutrients. However, sometimes it produces too much acid, irritating the stomach lining and causing discomfort. Several factors can trigger this overproduction, leading to various gastric issues. What we eat plays a crucial role in maintaining stomach health. Fatty, fried, and spicy foods are common culprits that can exacerbate gastric problems. Additionally, how we eat matters significantly. Eating too quickly can lead to swallowing air, causing bloating. Large meals, especially close to bedtime, can worsen symptoms by increasing acid production. Stress, smoking, and excessive caffeine or alcohol consumption also contribute to the problem, disrupting normal stomach function. By understanding these triggers, we can make informed choices to minimize their impact and maintain a healthy digestive system. One of the simplest yet most effective ways to reduce gastric issues is to adjust your diet. Start by identifying and avoiding trigger foods. These vary from person to person, but often include fatty, fried, and spicy foods. Instead, opt for whole unprocessed foods that are easier to digest. Fruits, vegetables, lean proteins, and whole grains are excellent choices. These foods provide essential nutrients without overloading your digestive system. Remember, a balanced diet is key to a happy stomach. Section 4. Portion control. The power of small, frequent meals. How you eat is just as important as what you eat. The timing and size of your meals can have a significant impact on your overall health and well-being. Large meals put extra pressure on your stomach, increasing the risk of acid reflux and indigestion. This can lead to discomfort and even long-term digestive issues. Switching to smaller, more frequent meals throughout the day can significantly alleviate these problems. It helps in maintaining a steady energy level and prevents the feeling of being overly full. This approach allows your stomach to digest food more efficiently, reducing the likelihood of discomfort. It also helps in better nutrient absorption and keeps your metabolism active. Try eating 4 to 5 small meals instead of 2 or 3 large ones. This can help in managing hunger and preventing overeating. This simple change can make a noticeable difference in your digestion and overall health. Give it a try and feel the positive effects on your body. Section 5. Beyond the plate. Lifestyle changes for digestive harmony. While diet plays a vital role, other lifestyle factors also impact your digestive health significantly. Physical activity, for instance, not only aids digestion, but also reduces stress, a known trigger for various gastric problems. Incorporate moderate exercise into your routine, aiming for at least 30 minutes most days of the week. This can include activities like jogging, cycling, or even a brisk walk. Additionally, stress management techniques like deep breathing, meditation, and mindfulness practices or yoga can help calm your mind and body, easing digestive discomfort and promoting overall well-being. Remember, a holistic approach that combines diet, exercise, and stress management is crucial for long-term digestive well-being and overall health. Section 6. Seeking expert help. When to consult a doctor. While lifestyle changes can significantly improve gastric issues, it's crucial to seek professional help if symptoms persist. If you experience frequent or severe heartburn, indigestion, or other digestive problems, consult your doctor. They can help determine the underlying cause and recommend appropriate treatment options. Remember, self-treating can sometimes mask more serious issues. Always err on the side of caution and seek professional guidance when needed.